I want to specially discuss nutrition in children with acute kidney injuries. Nutrition in children with acute kidney injury. So you're just trying to look at, the food consideration, all right? Which food you should give, which food you shouldn't give in a child that has acute kidney injury issues. So for what we have, we said that nutrition in acute kidney injury is a delicate stuff. You calling it a delicate stuff simply means, you understand, the kidneys are not in a good state at that time. Do you understand? So you don't want to give any food that will stress them. So you don't want to give any food that will stress them. Do you understand? So you want to still continue giving food, but you want to avoid any food that will stress the kidneys, leading to fluid overload. Okay, you are trying to avoid anything that will lead to electrolytes not being balanced up in the body. This is because AKI alters metabolism, and treatment often involves dialysis or fluid restriction. Okay, so key principles of nutrition in pediatric acute kidney injuries is early and ongoing assessment. So there are so many things that you actually pick up early up in the disease, and as you are feeding the child, as you are treating the child within the disease condition, you are still accessing for all those parameters of kidney damage. Energy requirements, so this one you are aiming to meet the basic metabolic needs of the child. So energy needs to be increased because there's a whole lot of inflammation, there's a whole lot of issues in the body. Okay, so avoid overfeeding in such a child. Avoid overfeeding in such a child. Now for next off, we said our protein needs. So protein requirements are higher in acute kidney injury. This is due to increased breakdown and losses during dialysis. So typical targets, this is a typical target for your proteins in a day. If the person is on dialysis or if the person is not on dialysis, then keep monitoring for energy, therefore protein energy wasting. The fluid management, so that your fluid intake should actually align with how the person's kidneys can still be able to keep up with putting out the fluid from the body. Then electrolytes and micronutrients. Potassium is often restricted. Phosphorus may require binding agent or restriction, because all these things in a normal person, when you take it, it's your kidneys that will put them out. The sodium should also be tailored to the fluid status. Calcium, magnesium and vitamins may also be needed. Now, routes of nutrition, oral feeding is usually preferred. There's sometimes NG tube or gastrotomy if the oral feeding is inadequate. So this is it around nutrition in children that have acute kidney injury.